Nobody teaches you this stuff in school. You learn algebra, you learn about photosynthesis, but nobody sits you down and says, hey, here's how to not go broke if you get sick. And then one day, you get your first real job. Or you turn 26, and suddenly HR hands you a 50-page booklet with words like deductible and coinsurance, and you smile and nod like you understand. But inside, you're screaming, I've been there, and today I'm going to break this down so simply that by the end of this video, you'll be the person in your friend group who actually gets it. Part 1. What even is health insurance? Okay, let's start at the very beginning. What is health insurance? At its core, it's a safety net. It's a big pot of money that a bunch of people pay into every month. When someone in that group gets sick or hurt, the money from the pot helps pay their medical bills. Think of it like a gym membership for your body, except instead of using it to feel good, you use it so you don't get crushed by a $50,000 hospital bill when something goes wrong. Now here's the catch. The insurance company isn't a charity. They're a business. They collect premiums from thousands of people, pay out claims for the ones who get sick, and keep the difference as profit. It's a bet. They bet you'll stay healthy. You bet you won't. And that's the game. Part 2. The 4 pillars of your plan. Alright, grab a pen or just use your brain. There are 4 main terms you need to know. I call them the 4 pillars of pain. Master these, and you've basically won health insurance. 1. Premium, the monthly bill. This is your monthly fee. It's the amount you pay every month, no matter what. Whether you go to the doctor 0 times or 10 times, you pay this. Think of it like a Netflix subscription. But instead of watching movies, you're paying for the ability to not go bankrupt if you break your leg. 2. Deductible, the pay-it-yourself zone. This is the big one. The deductible is the amount of money you have to pay out of pocket for medical care before your insurance company starts chipping in. Let's say your deductible is $1,500. You go to the doctor for a sore throat. That costs $200. You pay that full $200 out of pocket. But wait, that $200 counts toward your deductible. Now you get an x-ray. That costs $1,300. You pay that too. But now you've paid a total of $1,500. That means your deductible is met. Once that fence is open, the game changes. Now the insurance company starts paying their share. This leads us to 3. Copay and coinsurance, you're split. Once your deductible is met, you aren't off the hook entirely. You still have to share the cost. Copay, this is a fixed amount. For example, $30 for a doctor's visit or $10 for a generic prescription. It's predictable. You pay $30, they pay the rest. Coinsurance, this is a percentage. Instead of $30, you pay 20%. So, if your coinsurance is 20% and your surgery costs $10,000, you pay $2,000 and the insurance pays $8,000. Notice how this can still get expensive. That's why we have number 4, out-of-pocket maximum, the shield. This is the absolute cap on how much you have to pay in a single year. Let's say your out-of-pocket max is $6,000. If you have a terrible year, multiple surgeries, hospital stays, etc., and you rack up $100,000 in bills, you only pay $6,000. Once you hit that max, the insurance company pays 100% of covered costs for the rest of the year. It is your emergency parachute. Part 3. Navigating the system, in-network versus out-of-network. So now you know the money, but there's a trap, and the trap is called network. Insurance companies make deals with hospitals and doctors to get discounted rates. These doctors are in-network. You want to stay in-network. It's cheaper. If you go to an out-of-network doctor, your insurance might not cover it. Why? Because they haven't signed that discount deal. Here is the secret danger, the surprise bill. You go to an in-network hospital for surgery. You check everything. It's all good. But then the anesthesiologist walks in, and they aren't in your network. You wake up and get a huge bill from that person. It's annoying. Your responsibility. Always ask, are you in network? It's a pain, but it saves you money. Part 4, HMO, PPO, and the alphabet soup. Now, you usually have to choose a type of plan. You'll see letters like HMO, PPO, EPO, and POS1, HMO Health Maintenance Organization. You have a primary care physician, a gatekeeper. If you want to see a specialist, you must get a referral from your PCP first. If you don't, they won't pay. 2. PPO, Preferred Provider Organization. You don't need a referral. You can go see any specialist you want whenever you want. It's more expensive, but if you hate waiting for permission, this is for you. Most people choose PPOs because of the freedom. Just remember the P stands for Preferred In-Network. 3. EPO, Exclusive Provider Organization. Think of this as a mix. You don't need a referral, but the plan will only cover in-network care. There is 0 coverage for out-of-network unless it's an emergency. Unless you have specific specialists you see often, usually the PPO is the easiest to understand. Part 5. The practical hack. What to do when you actually get sick. So, you have the plan. But what happens when you actually need to use it? Let's do a day in the life. You wake up with a terrible earache. Step 1, you check your card, you find the member services number or look up your online portal, you find a doctor in your network. Step 2, you go to the doctor, you pay your copay, let's say $30. Step 3, the doctor bill goes to insurance. Let's say the bill is $200. You haven't met your deductible yet. You owe the $200, but wait, you already paid $30. So you get a bill for $170. Step 4, you pay $170. It's boring, it's administrative. This is how it works. Don't ignore bills. Call the billing department. They usually give discounts if you pay quickly. The rule of thumb is, don't panic, just read the mail. Health insurance is not fun. It's confusing on purpose. But by understanding these 4 numbers and asking the in-network question, you're already ahead of 90% of people. You are now a health insurance master. If this helped you, please hit that subscribe button and ring the bell. Take care of yourself and I'll see you in the next video. Don't get sick.